I think we are starting to see some changes in the whole healthcare system. With the Obamacare and a trend toward reimbursement for essentially keeping people healthy rather than reimbursement for letting illnesses occur and then doing things that are often not very effective after the illnesses occurred. That shift, I think, is starting to happen, and I have seen greater interest in insurance plans, realizing that the current practice is sort of perverse in terms of the incentives for the healthcare system. Hospitals want to keep their beds full. They don't want to keep their beds empty. We spend about twice as much per person on healthcare as almost every other country in the world, and yet we rank number 36 right next to Romania in terms of life expectancy. So clearly we're spending huge resources and not getting the health that Americans deserve.
And do you see health coaches having a role in this, a role in contributing to people's health and transitions?
I think health coaches can play a very important part in the effort to help people adopt better lifestyle practices. Physicians, unfortunately, have not played nearly as much role as they should have been. We were not trained. When I was in medical school, had very little training in nutrition, and that has not increased even up till today, even though we know it's much more important. And so physicians in general are not equipped to provide the kind of intervention guidance that they should. And then practice is set up so that they're reimbursed for doing other things, but not for providing better counseling about dietary choices. So I think there's a major gap, and health coaches are very important.
What are the major changes that you've seen throughout your career?
We've had really some major changes in the area of diet and health, that when I started working on this topic back in the 1970s, people were given strong recommendations. Don't eat more than 2 eggs per week was one of them, and really avoid saturated fat in every way that you could. And I started to, as a young investigator at that time, started to look at the literature, to dig down to see what was supporting those recommendations. And to my astonishment, there was virtually no evidence to support many of these recommendations. There's a long way to go, and one of the important findings is there's a bigger and bigger gap between people who have more education and more resources and people with low education and minimal resources. So from a public health standpoint, that's a huge concern. The income gap and knowledge gap is translating into a massive gap in eating quality as well.
Right, and I think that's really where health coaches come in too. We're hoping that, you know, the more coaches we have out there, the more coaches that will be able to reach and impact as many lives as possible.
Absolutely, health coaches, I think, will play a key role. We know that from other kinds of coaching, other kinds of health coaches in many countries around the world, actually including back in the 1930s in the United States. Many people may not realize, but we didn't call them health coaches at that time. They were called extension workers, and their job was to work with low-income families, mostly rural at that time, in terms of providing better nutrition. Many times people were deficient more than they are today. But they really were health coaches, and they had a big impact. That was a role that was sort of forgotten, and we clearly need that kind of coaching perhaps more than ever.
Absolutely. Thank you.
Thank you.